everyone. It's Friday, the 17th of September. Today's been a busy day, running in a lot of directions and everything, and going to end up the day down at Marshall. The WVU and Marshall soccer teams are going to be playing each other, and there's a lot of other really neat stuff that's going on down there from the standpoint of, I guess, recognizing, surely not celebrating, the day of the plane crash, and folks down there that we're going to talk with, that were our first teams, and from the standpoint of then the Hall of Fame dinner with the in the Business Hall of Fame, we're going to honor two or three great people that are very, very deserving. But nevertheless, it's there's no point in me, I guess, just continuing to belabor. I keep telling you, that I truly in my heart believe without any question that we need to get vaccinated. I've also had a great conversation with a really dear friend and everything, and in her life, she truly believes that the antibodies are present. She's gotten through COVID, and with all that, she expresses a lot of really good points, and that is just what I've said over and over and over. A lot of people that are out there have a lot of reluctancy, is to step up and get this shot. I wish to goodness that everybody would, but at the same time, we want to be respectful, do we not? In this country, everyone in this country has a gift that is unbelievable, and the price tag for it has been paid for by our military and all of our fallen heroes in every way. But that's freedom. And with all of that, they should make their own decisions. And so we probably, absolutely, without any question, need to continue to do more and more research over the folks that have had COVID and the antibodies and how well they're protected and everything on that. But for what we know and for what I know, I'm not a doctor. All I can tell you is just this. The only thing that I have in my arsenal that will make this get better is for you to get vaccinated. That's all I've got. Now, and at the end of the day, I surely to God above don't want you to get COVID so that you'll have antibodies so that you won't have to get vaccinated. But we should be absolutely researching more and more. We should absolutely, without any question, in my opinion, not be mandating employees or whatever it may be that they have to do something. We'll get through this. Unfortunately, today, we have an overwhelming amount of deaths. 74 people have died. 74 more people have died since Wednesday. And they'll keep dying. That's all there is to it. We just are going to keep lining the body bags up, and we're going to line them up until we absolutely either reach a situation to where we do have natural immunities, and we have reached a situation to where we do have a bunch of people vaccinated that don't have those immunities. And so with all of that, at the end of the day, we're going to do one of two things. We're going to run to the fire and get vaccinated right now, or we're going to pile the body bags up until we reach a point in time to where we have enough people that have natural immunities and enough people that are vaccinated. Now, that's all there is to it. I would really highly encourage you to go get vaccinated. 74 deaths. The 3,297th death, a 50-year-old female from Mercer County. The 3,298th death, an 84-year-old male from Wood County. The 3,299th death, a 65-year-old male from Wood County. The 3,300th death, a 52-year-old male from Ritchie County. The 3,301st death, a 79-year-old female from Raleigh County. The 3,302nd death, a 91-year-old female from Preston County. The 3,303rd death, a 56-year-old female from Wetzel County. The 3,304th death, a 70-year-old male from Kanawha County. The 3,305th death, a 52-year-old male from Kanawha County. The 3,306th death, a 45-year-old male from Greenbrier County. The 3,307th death, an 89-year-old male from Wetzel County. The 3,308th death, a 77-year-old male from Marion County. The 3,309th death, a 67-year-old female from Preston County. The 3,310th death, a 46-year-old male from Kanawha County. The 3,311th death, an 89-year-old female from Raleigh County. The 3,312th death, a 33-year-old female from Kanawha County. The 3,313th death, a 56-year-old female from Harrison County. The 3,314th death is a 75-year-old male from Clay County. The 3,315th death, a 95-year-old male from Monongahela County. The 3,316th death, an 84-year-old male from Raleigh County. The 3,317th death, a 61-year-old male from Mercer County. The 3,318th death, an 85-year-old female from Tucker County. The 3,319th death, a 70-year-old female from Barber County. The 3,320th death, a 67-year-old male from Wood County. The 3,321st death, a 45-year-old male from Wood County. The 3,322nd death, a 76-year-old male from Morgan County. The 3,323rd death, a 63-year-old male from Harrison County. The 3,324th death, a 70-year-old male from Mercer County. The 3,325th death, a 50-year-old female from Greenbrier County. The 3,326th death, a 47-year-old male from Mercer County. The 3,327th death, a 56-year-old male from Monongahela County. The 3,328th death, a 54-year-old male from Wayne County. The 3,329th death, a 59-year-old female from Barber County. The 3,330th death, an 84-year-old female from Mingo County. The 3,331st death, an 80-year-old male from Lincoln County. The 3,332nd death, an 89-year-old female from Monongahela County. The 3,333rd death, a 67-year-old male from Mingo County. The 3,334th death is a 73-year-old female from Mason County. The 3,335th death, a 91-year-old male from Kanawha County. The 3,336th death is an 87-year-old female from Work County. The 3,337th death, an 83-year-old male from Brooke County. The 3,338th death, a 77-year-old male from Monongahela County. The 3,339th death, a 63-year-old female from Mason County. The 3,340th death is a 52-year-old female from Wood County. The 3,341st death is a 92-year-old male from Mercer County. The 3,342nd death, a 50-year-old female from Randolph County. The 3,343rd death is a 73-year-old male from Mercer County. The 3,344th death, a 69-year-old female from Ohio County. The 3,345th death, a 78-year-old female from Cabell County. The 3,346th death, a 74-year-old female from Wetzel County. The 3,347th death, a 49-year-old male from Cabell County. The 3,348th death is an 84-year-old male from Greenbrier County. The 3,349th death, a 63-year-old female from Mercer County. The 3,350th death is an 86-year-old female from Kanawha County. The 3,351st death is an 81-year-old female from Kanawha County. The 3,352nd death is a 71-year-old male from Logan County. Continuing with the DHHR's reconciliation of official death certificates, there are 18 more. The 3,353rd death is a 52-year-old female from Wayne County. The 3,354th death is a 99-year-old female from Monongahela County. The 3,355th death is an 81-year-old male from Mercer County. The 3,356th death, a 43-year-old male from Berkeley County. The 3,357th death, an 88-year-old male from Kanawha County. The 3,358th death, an 88-year-old female from Summers County. The 3,359th death, an 83-year-old male from Morgan County. The 3,360th death, a 68-year-old female from Greenbrier County. The 3,361st death is a 49-year-old male from Cabell County. The 3,362nd death is an 88-year-old male from Pleasance County. The 3,363rd death, a 62-year-old male from Kanawha County. The 3,364th death, an 85-year-old male from Mineral County. The 3,365th death is a 63-year-old male from Kanawha County. The 3,366th death is an 80-year-old female from Wayne County. The 3,367th death, a 97-year-old female from Greenbrier County. The 3,368th death, an 84-year-old female from Preston County. The 3,369th death, a 58-year-old male from Raleigh County. And the 3,370th death in West Virginia, an 88-year-old female from Mineral County. I tell all of you, do you remember when we had the Delta variant? We had 12 cases in West Virginia. Did you really listen closely to Dr. Marsh, General Hoyer, Dr. Amjad, Secretary Crouch, myself? We told you this day was coming and it was going to be really tough. We have hit a brand new all-time pandemic peak of 29,744 active cases in West Virginia. 2,320 new positive cases since yesterday. An 11.43% daily positivity rate. Our cumulative rate is at 5.63. We have 905 people hospitalized, 278 in the ICU units, and 166 on ventilators. We're going to have a bunch more die. That's all there is to it. And the only way we can stop it from being a bunch more and then a whole lot more on top of that, in my opinion, is one thing, and that's get vaccinated. I'm going to continue to plead with you to do that because I don't know anything else we can do. You know, surely to God above, I'm not going to tell you go get COVID and I hope to goodness you survive. And if you survive, then you're going to have antibodies. But if you have gotten it and you do have natural immunity, I hope and pray you are safe. I really do. We've got 45 of our counties that are in the red. And I guess at this point in time, I told you that I was going to announce something on Friday, and this is the monoclonal antibody expansion. And we were going to talk about that the other day. You know, General Hoyer has a whole lot more information, and then we've got a couple of folks that are going to join us that are doing great work. And so if General Hoyer would take over now, it'd be good.
Yes, sir. Thank you, Governor. As the governor has pointed out and laid out, he has tasked us to improve and expand the access to the monoclonal antibodies and ensure better logistics flow and management, and also to relieve pressure off of hospitals, which have been our primary outlet to date for the delivery of the antibodies. So what we have done is worked using our Joint Interagency Task Force network that does the vaccine distribution to increase in 30 additional counties, additional access points to include pharmacies, local health departments, as well as local health centers to make those available. We're also through DHHR providing additional testing capability. So for example, an individual could go to a local health department, a local health center and get tested, triage, and have the availability of the antibodies if that is the appropriate call of the medical professionals there. I think it's important, as the governor's pointed out before, the antibodies are not a replacement for the vaccine, but they are a life-saving tool, particularly if we get to an individual at the appropriate time. So again, the tasking given to us is to bring this under a central management oversight, just like with vaccines, and improve and expand access, create better logistics management, and hopefully relieve some pressure off of our hospitals, particularly our emergency rooms. We'll continue to work through the weekend and into next week. There is the system through the U.S. Department of Health and Human Services where these outlets will be signed up, and then there'll be an overarching management structure at the state level, and deliveries will go directly to these locations. I do want to point out too that there's been a lot of confusion about availability antibodies and not. We have worked with hospitals over the last couple of weeks where there have been additional needs at certain hospitals, and others have had available resources to move resources back and forth. But our analysis to date shows that the state of West Virginia has not to date exceeded its allocation that is available to it. Should that happen as we expand the access, we're already working with U.S. Health and Human Services to have additional antibodies available. We need to understand that part of what was created in this confusion was that for a period of time, there were 5 southern states that had exceptionally low vaccination rates that were using 70% of the nation's supply of antibodies. But we believe we have a good plan in place. We have a lot of great people at the local level working in partnership, and we know what the governor's direction and guidance is to us, and we will carry it out. Thank you, Governor.
Okay, if we could go to Commission President Kent Carper and Dr. Sherry Young. People have done wonderful work here in Kanawha County and in this great town of Charleston. And so I think they're with us today and they'd like to talk with us. And again, I thank them for working with this administration and all the good work that they've done for each and every one of us.
Thank you, Governor Justice.
Go ahead, Doctor.
Thank you, Governor Justice, and thank you to your wonderful team for allowing us to be on today and talking about our work here in Kanawha County. Without the work of your team and the GIATA making sure that we have the supplies that we will need moving forward, we wouldn't be able to make the announcement that we are doing monoclonal antibody infusion starting today here at the Kanawha Charleston Health Department. So far, we have treated 6 individuals who were COVID positive successfully. Happy to report that they're all doing very well. They all tolerated the treatment very well. And that is 6 people, while it sounds like a low volume, 6 people we will hopefully keep out of the hospital. This has been a wonderful effort as a last-ditch effort, in addition to the amount of testing, contact tracing that we're doing, and of course, continuing the immunization process. And to reiterate all of the medical science here, of course, we cannot overstress the fact that while monoclonal antibodies do have their place, it does not take away the importance of getting that vaccine. We do need to get more vaccines in arms, and we want to continue that process. I also want to thank the West Virginia National Guard for coming in and helping us with these processes, because if they weren't here to help us with the other clinical divisions we're managing right now, we wouldn't be able to take on this extra duty of doing the monoclonal antibodies. With that being said, to echo the sentiment of Governor Justice, we have lost 15 people in Kanawha County this week alone, and that is far too many. We don't want to lose anybody else. So with that, I do urge everybody to receive their vaccinations. Know that we will be here on Sunday from 1 to 5 for anybody needing vaccinations, COVID testing, and we hope to be doing antibody injections on Sunday as well. But with that, thank you for having us on, and thank you for helping us with our good work.
Governor Justice, I would also like to add exactly what Dr. Young said. We got a clear message from General Hoyer, your chief of staff, Dr. March, and everyone else, basically what you all were working on. Our responsibility, we believe, in local government is to be a support unit. Dr. Young, within less than 2 weeks, stripped a room out, put the linoleum in, has the chairs, has the equipment, and trained people to do something they've never done before in their life. In the fire service, we talk about a backfire. When you absolutely cannot stop a fire from overrunning you, the last thing you do is do a backfire. And basically, that's what this is. It's an opportunity. MABs work. Trust me, I know that they work. And we are proud to follow your leadership. And frankly, Governor Justice, when I first heard you a long time ago refer to COVID as a monster, well, if COVID was the monster, then Delta is the spawn of a monster, and we know what it does. And it's killing people all over this country, all over your state of West Virginia, Governor. And it's basically because of the lack of vaccinations, not the availability. You've got them everywhere. You've done everything you could do, but we're still going to attempt to persuade people. There's not a day goes by that we don't try to do vaccinations, and that's exactly what we intend to do. So, Governor Justice and your team, on behalf of Kanawha County, thank you.
No, Mr. President Kent, good friend and everything, and Doc, thank you all so much for all you do. Okay, I'm gonna, I guess, go back to my, all right. Well, let me read you some more numbers. We've got 88 school outbreaks now in 35 counties. We've got 786 confirmed cases. 7 schools are closed. 1 county completely, that's Preston. We need our kids to be in school, do we not? That's all there is to it. And, you know, with the outbreaks, I guess, as severe as they are in Preston, we you know, evidently the local, you know, school board or whatever thinks there's just no point, no way on earth we could have school. We have 53 counties that have a mask mandate. Putnam and Pocahontas still don't. We have bunches and bunches of folks that are hospitalized. The overwhelming percentage, you know, is people that aren't vaccinated. Reminder over and over to you, if you're 65 and older and you get any symptoms, for God's sakes a living, please, please go get tested. The antibodies will save your life. And really and truly, you hear all the names, all the ages. I encourage you, if you're in a big crowd of people, especially indoors and everything, especially if you're older than 65 and you're compromised anyway, I really think you ought to really consider wearing a mask. We'll be ready, you know, with the, as soon as the FDA says go on the booster shots, and we're watching it like crazy. They're meeting right now, and if they came out of that meeting with a decision on booster shots, we'd be ready to go today. But we're ready. We're ready as soon as they give us the green light. A lot of the complication in West Virginia, we led the way. We led the way with vaccination. I'm sure we saved thousands of lives. There's no question about that. Absolutely, though, now we're out where we led the way and we got people vaccinated early. We're out well past the 6 months that we've got a bunch of people that need vaccinated. We got 92.7% of the 65 and older, 86.8% of the 50 and older, 74.3% of the 12 and older all have 1 shot. Yesterday we went out on the baby dog, Do It for Baby Dog round 2. We were able to give away some scholarships, and we gave away a car and some free gas, you know, for 10 years to a gentleman that I don't know if he's with us today. Is he with us? Okay, but he gave a tremendous testimony. This was Lewis Wood of Hyco. He stood up and said, you know, I didn't get vaccinated, and I ended up in the ICU unit in the hospital for 18 days. And was on a ventilator for 7 days. His very words were just this: it was a living hell, and I would encourage everyone to get vaccinated. You know, we went to Greenbrier West, a school that is, according to my wife, you know, I haven't been in Greenbrier West in a few years. I substitute taught there a long time ago. But a school that is spotless. with kids that are so mannerly and so good. They made that banner just, I think, the very morning that we came. But nevertheless, you know, there was a gentleman there, Waylon Gilkinson, and Waylon is a young custodian at Greenbrier West that just won a full ride scholarship. Waylon wants to go to school and really and truly loves Greenbrier West, wants to be a teacher, but really couldn't quite put it together and swing it. And now he's got a shot. And then we went on from there, and we went to the Fayette County Courthouse, where we gave Aaron Statler, you know, a brand new, incredible car. We gave Lewis Wood gas for 10 years and heard his unbelievable testimony. And then we went there and wrapped the day up at Hurricane High School. You know, the Hurricane High School, you know, their marching band was out on the field with us and everything, and what an incredible talent that they are. You know, their superintendent was there, their principal was there, absolutely many of their teachers and everything, and their little baby dog was coming out as well. Now just think about it just for a second. There was a young lady there, Livy Miller. Livy Miller has a 4.2 grade point average. And Libby, from what I understand, was working a job, saving money, trying to forecast and be ready to be able to go on and further her education. Well, she doesn't have to worry a whole lot about that now, because Livy and all the students and all the faculty and superintendent and administration and everything, all of them wish her the very best and everything. She's got a full ride, 4-year scholarship. She said yesterday she's thinking about going on to WVU. I mean, Livy will absolutely knock it out of the park. So what a wonderful day. Good stuff. Really good stuff. So nevertheless, we want to keep encouraging and keep being in front of everybody we possibly can. And look at that face. Hard to turn that face down, that's for sure. Our vaccine eligibility is 12 and older. The young people need to get vaccinated, more and more of you, and our parents and grandparents. If you can help us more and more to get them across the finish line, it'd be great. Our COVID vaccine line's up. All the testing stuff you know about, it's free. Frith and Walgreens, I thank them every day. We have 79 outbreaks in our long-term care facilities, 4 churches now, in 4 counties, Braxton, Monroe, Raleigh, and Wayne counties. Get this number, we have now 227 inmates. Remember when that number was either 0 or 1? Just the other day. Now we have 227 inmates at 16 facilities, and 61 staff cases at 22 facilities have this. I encourage you about giving blood. I encourage our grandfamilies to get their, the kids in their homes, vaccinated and take advantage of this $150 school voucher. It's all out there. This is a little bit of an update. Just today, we have now officially, crossed a milestone that people would have never dreamed even could possibly exist. We have crossed a milestone that we've got $1 billion plus in the rainy day fund. And we have absolutely done so by accumulating surplus after surplus after surplus. We've worked hard with this administration. We've worked hard with the legislature. We worked hand in hand. We absolutely keep a flat budget. We do not grow and let government just bloat. But in all of that, this state is so incredibly healthy right now, and it's cooking. And that's what we want to keep on doing and everything. Keep opportunity coming to this state and literally just continue to grow. Got another announcement here that yesterday I announced that there's a Turkish mining company, CS Global Group, has chosen Moundsville, West Virginia as their location for their first manufacturing plant in the United States. So think about that. They chose West Virginia for their first manufacturing plant in the United States. Doesn't that tell you a whole lot? Doesn't it tell you really and truly that we're getting looks now that we would have never gotten before? So I can't be more proud of this, and I can't be more thankful of these great folks and everything. They're going to invest $10 million, and they're going to have 47 full-time jobs here. It's great stuff, good stuff. And I think I've got one more thing, and that is earlier this week, I announced that we had launched a new website called West Virginia Business Link. Business Link has all the resources that our state's small business owners and entrepreneurs need to succeed. And I'm not going to go through all that, but get this. Business Link is founded by the West Virginia Department of Economic Development, the Small Business Development Center, and the Entrepreneur Ecosystem. I mean, I don't know how in the world the work of our own people, I've said it so many times, we are the diamond in the rough that everybody missed, and we're showing it over and over and over, and I couldn't be more proud. Thank you all so much and everything, and we just got to stop this terrible killer that's eating us alive. Thank you so much.
Thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. In breaking news, the FDA apparently just rejected a widespread use of booster vaccines in the country, but it's not clear if there will still be a targeted group of people. I think most of the data, mostly from Israel, would suggest that perhaps people over 60 or 65 years old who are greater than 6 months from the vaccine are the ones that might have the most likelihood of a positive response. From the data from Israel, an 11 times increased reduction of infection and a 20 times reduction of severe disease. But more to follow on that. But that vote, according to what we just saw, was 61-3 against widespread use of the vaccines for people greater than 6 months out. So more to follow on that. We know, as the governor said, that West Virginia has been bearing the brunt of the Delta variant of COVID-19. Today in West Virginia hospitals, we have more people than ever before, 922 people in hospitals, our previous high 818. And as recently as the first week in July, we had 52 people in hospitals in West Virginia. We have 277 West Virginians in ICUs with COVID-19. Our peak was 219, and we had 17 people first week in July, and we have 169 people on ventilators. Our peak was 104, and the first week in July, we were 6. So we are seeing a challenge to our hospital system in a way that we haven't seen before. And as the governor, as we've said many times, the governor has instructed us to focus on saving lives, protecting health, and protecting the hospital system, because he knows, and we all know, that if the hospital system gets into trouble, then not only do we have problems taking care of people with COVID-19, but we have problems taking care of people with heart attacks and strokes and infection and car wrecks, et cetera. So I'd like to suggest 5 things that we should really be thinking about together here. Number one is it is really an important time for us to stay together. This is not a time for us to fight each other. Number two, this is a time for us to choose full vaccination, because we know that 82% of people in our hospitals are unvaccinated, 90% of people in our ICUs are unvaccinated, and 91% of our population on ventilators are unvaccinated. And we know that overall, if we look at all of our deaths, less than 0.12% of our deaths are in people that are fully vaccinated. Number three is please choose to wear masks and other mitigation strategies when you're indoors around a lot of other people, and be smart. Right now, we don't need more people getting sick and going to the hospital. Number four, if you have the sniffles or runny nose, please get tested. And if you test positive, isolate and make sure that you are protecting yourself and protecting each other. And if you're in a high risk group, as we heard from Dr. Young and Commissioner Carper, go get monoclonal antibody testing. We've expanded the capabilities to do that. And they can only be life-threatening, but they can reduce your risk of getting severely ill and going to the hospital. And then number 5, we very much like people to make sure that they are really, really thoughtful when going to the emergency room or going to a hospital to be cared for. And certainly if you have a car accident or you have an acute injury, don't hesitate to go where you think the right place to be. But if you get a cold or if you have a problem, please call your primary care provider or the clinic, or there's urgent care centers, because we really don't want to add more stress to our hospital system right now. Our hospital system is still functioning fine. We're still able to take care of all West Virginians that need to be taken care of, but we're at a fragile moment, and we all need to do our part as great citizens, as great West Virginians, to make sure we make it through this challenge as well. One last note. Some people think that getting antibody treatment is the same as vaccination, and it's not. Antibody treatment is a passive treatment that only lasts for a short period of time, which can help you acutely get through and be protected from severe consequences of being infected with COVID-19. But it wears off over the next 30 to 90 days. Vaccine activates your immune system. So not only can you be protected from getting challenged today with COVID-19 with the Delta variant, but it will continue to actively protect you for the future. Thank you.
Thank you, Dr. Marsh. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I just wanted to remind everyone about the flu vaccines, that you do need to get them this year. And also, the governor did mention it earlier about the additional 18 deaths on the dashboard. That is a reminder that we are still doing a lot of data reconciliations with our epidemiology team and our death certificates. So that is something that we are going over as well. Thank you, Jordan.
Thank you, Dr. Amjad. Next, we'll go to Secretary Bill Crouch with the DHHR.
Hello, everyone. Thank you. As the governor said, we're working very hard to try to get these death certificates matched. We just want to mention again, still having a few quirks with the dashboard, so please bear with us on that. We're working very hard to fix those issues. Some technical issues keep popping up, but we're trying to make sure that you get the best information you can as quickly as you can. The governor is adamant that we're transparent, and that's what we're trying to do. So thank you.
Thank you, Secretary. Retired Major General Jim Hoyer, Director of our Joint Interagency Task Force, is also joining us today and available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with W News. Dr. Marsh, could you walk us through what someone can expect after receiving the monoclonal antibody treatment? You just described it as passive, so I'm assuming these folks would go to one of these 30 sites and then you just go home? And then also, I didn't hear anyone say this, but is this being offered to folks for free? Is this going to cost someone anything? Thank you.
Dr. Marsh, please.
Thank you, Governor. I'll certainly invite Dr. Young and Dr. Amjad to add anything in as well. Charles, thank you for the question. When we say passive, we mean that it is really a treatment, a therapy that is designed to bind up virus before the virus gets to the cell. So it is a laboratory generated set of antibodies, 2 monoclonal antibodies that tend to bind to the virus and block that virus from being able to get into the cell. So it does not activate the person's own immune system to make these antibodies. It provides those antibodies separate from the person's immune system. So when we say passive, we mean it's given like a therapy, like a drug. When we say active, the vaccines activate your own immune system and educate your immune system to be on the watch for any intervention or any infection with COVID-19, so that your body continues to be able to naturally fight that. And we use the monoclonal antibodies generally in people that are either unvaccinated who get infected, or people that have been previously vaccinated a while back where their immune function may not be sufficient enough to be able to deal with the COVID infection, particularly as we just mentioned the Delta variant as well. But people do go home, and I do believe they're free. But Dr. Young, Dr. Amjad, why don't you make comments as well?
Yes, so what we prep our patients for the antibody treatment is that they still may continue to have fevers, chills, aches for about 24 hours. Then usually their symptoms start to resolve. For the antibody treatment, it's not an immediate effect, but it does help in the long run. Of course, it does help statistically. We know that it helps keep people out of hospitals and keep them from getting critically ill. Again, not a substitute for the vaccinations, but a good product for helping keep people alive and help keep people out of the hospitals. As far as the antibody therapy, it is free of charge. When you come to the Kanawha Charleston Health Department, and I won't speak on behalf of the state, but working with the state, it is free of charge. It is no charge to the patient whatsoever.
Thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor. Good afternoon, cabinet members and staff and fellow reporters. Let me give a little shout out to my friend, Dr. Sherry Young, right now, because the Kanawha Charleston Health Department is having a Sunday clinic this week from 1 to 5. So if you're in Charleston, you need testing or vaccination, go see them. They're doing great work. My question is related to the monoclonal antibodies. I heard on a radio talk show today, and maybe this is a conspiracy theory, or maybe it's true. I had heard that there were supply chain issues, specifically involving southern red states. For example, Tennessee was promised 70,000 doses of monoclonal antibodies, and they've received only 30,000, and that this is happening to the other states. Are we having a supply chain issue, or is this just urban legend? And maybe General Hoyer can weigh in as well.
I think, General Hoyer, you got to do this.
Yes, sir, Governor. Related to West Virginia, Mark, I would call that an urban legend. There is not a supply chain issue. Again, reinforce what the governor's tasked us to do is to expand and improve access and create better flow and logistics management. And we don't see any supply chain issues in West Virginia right now.
Thank you, Mark. Next, we'll go to Bob Aaron with WCHS and Fox 11.
These numbers are changing all the time, but I think they now show that West Virginia has the highest number of COVID cases per 100,000 in the United States, and we're in the top 10 in terms of hospitalization and deaths. I think Dr. Marsh just told me to wear a mask if I didn't misunderstand him. Are we going to take any kind of measures like that, at least in public buildings, between now and the time we think this is going to peak? The Hospital Association said earlier today they're looking to see it cap out at about 1,000 patients inside West Virginia hospitals.
Well, Bob, let me answer that. You know, as far as how I feel right now, I mean, again, it's a balancing act to be able to keep us all moving in the right direction and keep us together. From the standpoint of the mask are not the answer. The answer is a vaccination. That's the answer, period. And there's no point in going any further. That's just all there is to it. The vaccinations are the answer. I think Dr. Marsh is telling you that if you're in a crowded building or whatever like that, you know, and you're surely, if you're elderly or you've got some, you know, health issues or whatever like that, you ought to really consider the masks aren't going to hurt you. That's for sure. And they can help to some degree, but that's not the answer. That's not the answer, Bob.
Thank you, Bob. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. I wanted to ask a question about the booster battlefield assessment. What kind of numbers are we getting out of that situation or that review that has been going on, I think, for a little over a month now? And also, if we could see some numbers or have a review of some of the numbers from how much the vaccine drops off after 5 or 6 months, that might allow people to be a little bit more careful and not feel maybe as much bulletproof with the vaccine. I know at the beginning, the Moderna and Pfizer were said to be about 95% effective, Johnson & Johnson around 70%. After 5 or 6 months, does that drop off to 50%? Can you give me a number? Thank you.
General Hoyer, try it. So, I don't know that we can absolutely give you an accurate number, Paul, but we can try a little bit here. Okay, General?
So, Governor, I'll give a couple of numbers and then I'll push it to Dr. Marsh. So as of yesterday, I believe we had done 800 nursing home and assisted living residents, and the more are in progress now. There is a team going out across the state working our nursing homes. We have a control group of about 100 folks who have been done, and we have a list of people available through the hotline who want to participate in the broader study. But I'll push it to Dr. Marsh to talk about the specific scientific and medical piece.
Thank you, Jim, and thank you, Paul, for the question. Certainly, when we look at antibody levels, one of the challenges we have today is there's no real clear cutoffs that say that this much is good, this much is better, and it's really a matter of looking and trying to develop that. And what we've seen for the first results that we've gotten back is about 10% or so of the people in the nursing homes that we've looked at who were vaccinated actually did not have a demonstrable antibody number left. And those people are what we would consider to be immunocompromised based on that, which is a really important finding. And as General Hoyer said, we are now well over 800 people that we've drawn that blood from, and we're doing the testing right now, running those results. What we also know, though, is that over time, which we've seen in our first result comparing a group that had blood drawn at the first vaccine, that we've seen a significant drop in many people. And as we start to compare what we're seeing with what Pfizer has reported, and Pfizer is really the leader for this, they report for the first 2 months, the vaccine is about 92 to 95% capable of blocking infection, not only severe disease, but infection. And then over that 2 to 6 months, it loses potency to where it gets more like 80% or so blocking infection. And data from Israel using Pfizer showed that people that were over 65 years old and who were over 6 months from their last vaccination had only a 30, or overall had people over 6 months had a 37 to 40% ability to fight off infection, and people that are over 65 and ill greater than 6 months before only had a 16% of fighting off infection. Now, this was with the midst of the Delta variant, which is what we're seeing now. And the challenge is that we know that the antibodies and the immunization give you a threshold. And maybe the threshold's here when you first get the vaccine, first couple months, and then it's here maybe by month 4, here by month 6. But the Delta variant is extremely infectious. And so the inoculum is really high. So we're trying to gauge what the immune response is, and that's what we're doing with our antibody study. But in the presence of the Delta variant, even a threshold that's still okay for a normal infection may not be sufficient for the Delta variant. So there's a number of variables involved. We're really looking for those people that have no antibody response, because we know that they are immunocompromised, and we can then give them the shot under that, sort of imprimatur, and we'll look to try to gauge what those other levels are so that we can then assess whether these people are really also immunosuppressed to give the third shot. And we'll wait for the FDA and the CDC to hope that they still okay boosters for some parts of our population.
Thank you, Paul. Next, we'll go to Jess Mancini with Ogden Newspapers.
Hi, thank you very much for taking my question. Governor or anyone on the panel, are we getting nearer or are we still further away from the peak of this latest surge? And depending on, and what are the indicators that that there may be that we're either close or we're far away? Thank you.
It's Jeff, is that correct? Jess. Okay, Jess, thanks so much for being on. And, I think General Hoyer can answer this better than I, but Jess, I feel in my heart that we're getting closer. But at the same time, when you lost 70-some folks and you had to go through and read these people and everything, it's really, really sad. That's all there is to it. So, General, maybe you can give us more accurate data on this, on the possibility of us getting close to the peak.
Yes, sir, Governor, and I'll ask Dr. Marsh to help me out a little bit here. But so our data analytics team has been looking at a number of different factors, and we do believe that we are within a short period of time from a series of a point of peak of cases. We use a lot of different factors to include, we do through WVU team a daily assessment of transmission rate, which is a key factor in helping us understand where we're at. But I think the important thing, and I'll let Dr. Marsh opine to this a little bit more, our data also shows us from past surges that once we hit a peak number of cases, we are somewhere around a 4-week period before we see a peak in hospitalizations. And Clay, I'll turn it over to you to add anything else.
Thank you, Jim. And as Jim said, that we anticipate a 2 to 4 week continued increase in hospitalizations even after we reach the peak of new cases. And deaths should even lag more, at least based on other countries and what we've seen before. So looking at our transmission rates, we do believe we are approaching the sort of, we talk about this inverted V, the top of the peak. But even when we start to see that come down some, then we still aren't out of the woods yet. So it's so important for each of us to recognize and really support each other, but also make sure that you're really careful right now, because our hospitals are really full and challenged in a way they haven't been challenged before. And so it's really all of our ability in doing the right things, the smart things that we can do to keep our hospitals doing okay, keep our, everything open for everybody. And that way, then we're going to make it through this together. Thank you.
Thank you, Jess. That's all the questions we have time for today. Governor, I'll turn it back to you to close out.
Nevertheless, I would tell you again, there's 74 families that are out there that are really hurting. I ask for your prayers. I ask for your thoughts. I ask for you to reach out if you know these families and make sure that they absolutely don't feel alone. And I ask for your prayers over the weekend, because this is tough stuff. That's just plain all there is to it. Everybody's working as hard as they can, and everybody is trying with all in them to absolutely do the right thing for each and every one of West Virginians. Like I said, I wasn't really prepared to close right there, but nevertheless, again, I just ask us to all keep pulling the rope together, because at the end of the day, casting stones at one another and pulling the rope apart and everything will just absolutely, it'll really, really, really be the wrong thing to do. So nevertheless, we're going to keep praying and we're going to get through it. Be tough, West Virginia. You can do it. Thank you.